Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. Just one or two brief comments on where I think we are. We know that the peak of the epidemic is not a long way off, but a reasonable way off. London, we're all reading about London in the press at the moment. London is probably about 2 to 3 weeks behind Italy, and Yorkshire is 2 to 3 weeks behind London. So we've got a matter of weeks, not a matter of months, but a matter of weeks to prepare. What I've seen over the last 2 or 3 weeks, probably 3 or 4 weeks actually, is an enormous effort across the whole of Sheffield, the council and well beyond the council, to prepare and to mitigate the worst impacts of this epidemic. There's no doubt we can't stop it, but what we are doing now is preparing so that we can mitigate the worst impacts. Someone characterised this really neatly to me the other day, and he said, well, this is a public health crisis. It's the worst public health crisis I think and hope I will ever have to see. A humanitarian crisis, a business continuity crisis, an NHS and social care capacity crisis, and an economic crisis all at once. That's never happened before. There's no rule book for this. We've got good arrangements in place, but there's many things that we just don't know how these things are going to play out. So, but I think what Sheffield in its entirety, the council and well beyond, is doing is amazing and is mobilised en masse really quickly. We haven't got everything right. There's no doubt about that, and we won't get everything right. But I think what Sheffield is doing will undoubtedly save lives and will also mitigate the worst effects of the epidemic, economically speaking. We know there are going to be many economic impacts of this for many years to come. So it's important that we do the preparatory work as best we can now.